Hello, hi JP, how are you?
I'm doing good.
Awesome. Yeah, thank you for taking the time. I have a few questions for you today.
Okay.
So, I know we, as a team, we actually have a lot of investment in having the data warehouse, curating the data, getting it ready for analytics. But as a team, and I've heard this from many people, that the insights are not in par with the investment that we do for our data. So, what would be your thoughts on that?
I think that's very true.
Mm-hmm.
And there's actually several reasons for that. I would say the number one reason, let's call it the go-to reflex. So basically what happens is you get a question, you use the same database.
Right.
Most of the time it's fine.
Mm-hmm.
But there are cases where the questions are a little different and you go and use the same database. For example, you get a question on, say, lab results, and you use your data, it doesn't have lab results, it only has lab orders. Obviously, if you had used a different database, you would get better answer.
Exactly.
Right? So the what we need to do is not to always use the same database. We need to go and understand what are the options that you have and use other databases that may be more relevant for the question that you're asking.
So that's a good point. But the problem that we face is there's limited budgeting. So
that's a very, very interesting point that you bring up, Shanmugam, because many of those data sources that are really helpful, they're absolutely free.
Wow.
Yeah. And everyone knows the Sunshine Act.
Right.
Right?
Yes.
But there are tons of them. They're like Medicare Part B, Part D. At the NPI physician level gives you the activity.
That's nice.
Right? That plugs big holes in the FFS, right? Fee-for-service, original Medicare.
Okay.
There's a reference database, DocGraph.
Right.
There's tons of clinical trials and tons of other data sets that you can use.
Okay.
That are absolutely free. So it's not a question of budget, right?
Wow. Yeah, that's good actually. Yeah.
Oh yeah, absolutely.
Wonderful. So, so when we have for the data sets that are already in the data lake, and even for new inbound data sets that we end up purchasing, right? How do we assess them? What is the mindset behind?
That's a very good question that you ask. And so no data sources are perfect, right? So what we need to do is to understand the holes, the biases, and the anomalies in the data.
Yeah.
And one good way to do that is to compare the data with some trusted external sources, like AP data, like a US Census, like SDOH, and it creates perspective. Then you can say, oh, there are holes in the data because, based on the AP, we should be expecting more, right? So that gives you that perspective that oftentimes, I wish that people would do that more in the industry.
Right. Yeah, I think that's a great perspective to measure the prevalence incidence, right?
That's right. The mortality
Right.
and so on. So you would know how many people have the disease and how many you should be expecting to have. Yeah.
Yeah, that's a good way to benchmark it. Absolutely. So I got to learn that we can use publicly available sources to complement our existing data warehouse. And I also saw how using trusted third-party AP data, we can actually benchmark and measure how it actually reflects the market landscape. So if I do these two, I should be good, right?
Well, there's kind of interesting. There's a third one, which is the caveats. So what's happening is when no data source is perfect, as we just said, right? So they have caveats. So we as analysts, we analyze the data and we glean the insights and then we give our recommendation. But the data has caveats. So if the right insight should be here, say the data is pointing this way. So what we need to take into account the caveats and course correct. And those would be the right insights to give to our clients, right? But if either we don't know the caveats or we just sweep it under the rug, then we miss that part of course correction. And actually, I've seen many examples in the industry where the lack of course correction actually leads to generating wrong insights. And that can be actually, the instinct could be very detrimental and not good for the company and for the person. Kind of not good for your career either, right? To say things that are not correct.
That's a very interesting point, right? And it's kind of tough, as I can imagine
It
as
is,
well.
it is, yes.
Right, but yeah, thank you for the wonderful insights today, JP. Yeah.
Thank you, Shanmugam.
Yes.
Take care.
Take care.
Bye.
See you, everybody.